Hello and welcome to DrDoctor, a channel focused on providing healthcare knowledge and advice to the general public with the aim of spreading awareness, spreading healthy behaviours and helping those in need. We start with a series on mental health. It is the most underfunded, most stigmatised and least understood aspect of medicine and healthcare, and thus it is the most important to talk about and to discuss. We will take you from depression to schizophrenia to personality and eating disorders and encompass much of what modern media fails to cover and correct many of the misconceptions and tackle the ongoing stigma associated with mental health. Today we will focus on depression, the most common mental health condition worldwide. 1 in 10 of us will suffer this illness at some point in our life, and this figure is the most conservative estimate. It crosses all social demographics, affects all ages, affects all races, and it affects all classes of people. And we all know 10 people at a close and personal level, and therefore someone we know, if not yourself, is likely suffering with this illness. And one of the saddest facts is that as many as 2/3 of people with depression do not realise they have a treatable condition, and thus they do not seek help. This is something we can change by spreading awareness and increasing our understanding of depression. So let's start by understanding depression. We all know it as low mood, right? Well, yes. But that is depression at its most superficial level. What depression truly is a mood disorder which can affect almost every aspect of your life, making you feel guilty, making you feel hopeless and worthless, destroying your energy levels, your motivation to do things that you want to or that you love doing, and your ability to concentrate. It affects your ability to sleep, your ability to eat. Essentially, it makes every action you take harder and seem less worthwhile. And at its most severe, depression can be life-threatening, reversing your basic instinct of survival into that of self-destruction. Now, we do need to remember that depression is unique to everyone suffering with the illness. Not only in the way the symptoms manifest themselves and the severity and length of those symptoms, but also in what actually leads to us suffering with this illness. In some people, there may be no clear cause. In others, there may be an obvious and specific trigger to this illness. So, is depression the same process for all of us, at a physiological and biochemical level? Well, no one truly knows how depression works inside our brains. There have been many theories and much research done over many years. There are no specific answers. It is probably not helpful, therefore, to attempt to understand all of these theories and to attempt to understand what is happening at a microscopic level inside our brains. What is perhaps more useful is understanding what can cause this illness at a macroscopic level, understanding the person behind the disease. What we do know is the factors that can lead to depression. For example, there is good evidence to show that going through difficult experiences in your childhood can make you vulnerable to experiencing depression later in life. This could be physical, sexual or emotional abuse, it could be neglect, it could be the loss of someone close to you, or even an unstable family situation. We know that in many cases you might find depression has been triggered by an unwelcome, stressful or traumatic event. This could be losing your job or unemployment, the end of a relationship, bereavement, major life changes such as changing job, moving house or getting married, being physically or sexually assaulted, or being bullied or abused. We also know that poor health can contribute to your risk of developing depression. Many health problems can be quite difficult to manage and can have a big impact on your mood. These are often chronic health problems, or those that are potentially life-threatening illnesses. We also know that research has shown that if you have a close family member with depression, you are more likely to experience depression yourself. Although no specific gene for depression has been identified, it is likely to have some sort of genetic basis as one of the risk factors. Alcohol and illegal drugs can both also cause depression. Although you might initially use these to make yourself feel better or to distract yourself, they often lead to a worse prognosis, as they in turn affect sleep and appetite, affect mood, and can lead to dependence and addiction. So now we know what depression is and what may have led to its manifestation, how do we beat it? Well, the first and the most important step lies with you. Even though this may be almost impossible, as the very nature of the disease strips your motivation and your energy levels and your very ability to function, taking an active role and taking the first steps for yourself can make a huge difference to how you feel. Our physical and mental health is supported by 3 key inputs that our body needs: sleep, exercise, and diet. Our mental health is directly correlated to these 3, and they affect each other in a very delicate relationship. Whilst having depression affects how we sleep and how we eat, and our energy levels to exercise, it is equally true that if any of these 3 are in imbalance, then our mood is affected negatively. One of the first things, therefore, is that we need to ensure we are getting good sleep. It is key for our brain, both in establishing pattern and routine, and also in enhancing our energy levels and settling our mood. There is lots you can do at home to improve your sleep, even if this seems impossible. I will leave a link in the description for some helpful information and also cover this topic in a future video. Keeping active is equally, if not more important, and this has been long established and deeply researched. Focusing on frequency of exercise rather than duration or intensity is often more helpful. So, light exercise, walking, swimming, yoga, as frequently as you can will stimulate your body and thus your mind. And perhaps the simplest thing of them all, focus on what makes you happy. Even in the darkest, most desperate depths of depression, making a list of people, places, things that make you feel happy or just less empty is a great way to start. And then to try and include these things into a daily routine if at all possible. And connecting with loved ones, friends and family alike, probably one of the most difficult things to do when you are suffering with depression. And this is often exacerbated by the general misunderstanding of depression and the associated stigma which unfortunately still remains. And for those of you watching this video who are not suffering with depression, use this opportunity to reach out to others. Share this video and take one step towards reducing stigma and increasing awareness of this all too common illness. So now that we have helped ourselves and taken one big step in a forwards direction to beating depression, we need to seek help. Depression is an illness just as much as any other physical health problem, and going to the doctors should be a natural, normal, and crucial step in getting better. So, what actually happens when we go to the doctors with depression? Well, the doctor will need to hear your story, what you are going through, and how you are suffering. In order to make a diagnosis of depression, there are 3 key symptoms that he will need to listen for: persistent sadness, low motivation, and low energy. And these need to have been present on most days for the past 2 weeks. There are also 7 further symptoms which will determine the severity of your depression. From here, the doctor will determine a plan together with yourself, a plan that suits you and works with what you want. A joint approach is often the most successful. A discussion on sleep, exercise and diet, and the differing self-help tools will often be the very first step. From there, the different types of therapy can be discussed, and potentially medication, although this is often not the first port of call. Undoubtedly, depression is an overwhelming and daunting experience, even in its mildest forms. But remembering that help is always available. 1 click, 1 phone call, 1 doctor's consultation away. You needn't ever let yourself suffer without help from the many services that are available. For those of you suffering, I sincerely hope that this video has offered some help, even in the smallest of ways. I will leave links in the description for plenty of useful and relevant sources of help and assistance. And for the rest of us, please share this video and help raise awareness and understanding, and let people know that we care. Please leave comments below, share your experiences, and leave feedback on what I should cover and focus on in future videos. Please subscribe and stay tuned for upcoming videos, and in our next video we will take a deeper look into the treatment of depression, including the therapies available and also antidepressants, the medications that can help us get better.